So the topic allotted to me is upper limb prosthetics and orthotics. Since I am the first today offline speaker. To morning you have been getting only online session. And in this talk, I will try to cover introduction also, prosthetics and orthotics, because we are starting the prosthetic and orthotics, the first talk on the prosthetic and orthotics. So introduction also part will be covered in this talk. So I think everybody must be aware of this definition. What is prosthesis? It is an artificial replacement for any or all part of lower limb or upper limb extremities. It is a device that is designed to replace as much as possible and the function or appearance of a missing limb or body part. Now coming to a little historical aspect. So first prosthesis was found in Roman Capua leg. It is found in tomb in Capua, Italy, which is dated to 300 BC, and it was made of copper and wood. So usually when there were a lot of wars in the ancient civilization, so they used to make this conventional prosthesis, and the soldiers were still using it, made of iron. Now what is the function of prosthesis? It restores function like weight bearing in the lower limb, and it restores cosmesis as well as function in the upper limb. When we are telling on upper limb prosthesis, we have to focus both function as well as cosmesis. Though some prosthesis may focus only on cosmesis and function may take a back seat, but with the recent advances, we are now covering function also, and as we will go further in this presentation, you will understand what I mean to say. So already definition of prosthesis we already know. So prosthesis may be used during activities, sports such as dancing, swimming, cycling, golfing and climbing, and it is mainly determined by the amputation or loss and location of the missing extremity. So what are the characteristics of successful prosthesis? It should be comfortable to wear, easy to don and doff, lightweight, durable and cosmetically pleasing, function well mechanically and require only reasonable maintenance, depends on the motivation of the individual. That is very important. Because if the person is not ready to wear the prosthesis, whatever you give, he or she may not wear. So the motivation is very important. Then from patient point of view, other consideration, amputation level, contour of the residual limb, expected function of the prosthesis, cognitive function of the patient, and then vocation of the patient, like whether he or she is doing desk job or manual laborer. And then avocational interest of the patient, like what hobbies does the person have, cosmetic importance, and there's financial resources. That is also very important, because when we speak rehabilitation, it is not only within the limits of disease, it is within the resources of the patient. So these are some design of upper limb prosthesis. So there are basically two types. One is transradial prosthesis, one is transhumeral prosthesis. One which we are giving in below elbow and another which we are giving above elbow. So we have current technology also, new plastic and other materials, carbon fibers, which have allowed artificial limbs to be stronger and lighter. And now, because of new cosmetic additional materials, look like more realistic. Sometimes when we see the pictures, we may not be able to identify also whether the person is wearing a prosthesis or not. And myoelectric limbs, they allow more direct control. And the emerging technology of nowadays, the time is of robotic limbs. So first upper limb prosthesis was only cosmetic. In 1960, first functional prosthetic hand was given. Sorry. There are two main types in the upper limb prosthesis: passive prosthesis and active prosthesis. Passive prosthesis is only for cosmetic purpose. They don't do any function. Whereas active prosthesis, they will do function as well as provide cosmesis. Nowadays, they very rarely we give passive prosthesis. We usually mostly give functional prosthesis. But in our department, we, in collaboration with plastic surgery, are doing cadaveric transplantation. So for cadaver, we are still providing passive or cosmetic prosthesis. So these are some examples of passive prosthesis, like cosmetic gloves are given to partial amputation of fingers and carpal bones. Now these are different hook terminal devices being used in the prosthesis, starting from the simplest one here to the most complicated one. So they can be changed according to the function the person want to do. Then there are electric terminal devices like this are there, which can be controlled by battery. Then coming to forearm transradial amputation, in this myoelectric devices are most useful. Electric hands in female, male, female and child size are available. Motor and batteries are placed in the wrist area. Optimum length is the distal third of forearm, and before a definitive myoelectric device has been fitted, initially a conventional body powered or cable controlled prosthesis should be fitted. And wrist rotated devices control pronation and supination of the stump within the forearm socket. And myoelectric hands are used for light activities. This is an example of a conventional transradial prosthesis. So if you see, this is a terminal device, then wrist assembly, then harness is coming up, and then there is a socket, and then harness is connected to the shoulder. And this one is a myoelectric one. So this is control with battery, and this is attached like this. So this is a person who is using it. So if you see cosmetically, you are not able to identify which hand he is using or not using. Now coming to transfemoral amputation, if the length of above elbow stump is less than 5 cm below anterior axillary fold, it will require a shoulder disarticulation type of prosthesis. If it is more than 5 cm, it can be prosthetically given lightweight forearm wrist terminal device components. This is an example of conventional transfemoral prosthesis. Again, wrist assembly, then terminal device, wrist assembly, then harness. In this, there will be two harness, one for controlling the elbow flexion, another for controlling the movement of voluntary device or terminal device. And this is another cable control. This is how it works like this. It can again, if modular also can be given, but mostly we give exoskeletal one. Now coming to active prosthesis, they are body powered, like at least one gross body movement should be available, sufficient residual limb and musculature. The advantages are highly durable, feedback is presently there, low maintenance cost, but disadvantage they are uncomfortable, restricted functional area, and appearance wise they are not very good. Then electrically powered prosthesis, use of small electric controls, myoelectric control, and they are the most popular used, and there is no harness, and their cosmetic appearance is good, and functional area is not much restricted. Whereas in disadvantage, use of battery and little expensive, and water, because upper limbs are mostly used for washing and other activities, so we have to prevent from water use. Now there is another variety of this hybrid prosthesis. In this, we combine both body powered as well as external powered prosthesis. So if you see in this example, there is body powered elbow joint and electrical wrist joint. And there are coming up ultralight prosthesis where pumps and valves are far away from the hand. This reduces stress and the lightness, impression of lightness. Now, what are the further evolutions in prosthesis development? We are now able to do communication with the prosthesis, feedback system, and prosthetic attachment. So some recent advances, just I will go through them. So what is this? Bionic arm. So how does it work? Electrodes attached to the muscle respond to thoughts, and then computer process signals from the electrodes, and then motors in the arm provide movement. So this is the way and then this is the sending the message. So this was developed under Revolutionary Institute of Chicago by Dr. Todd Quicken, and was first developed in 2002. Until now, they have fitted onto more than 50 amputees. So the same thing, bionic hand. In already told you, a motor is there and the control is through motor. Then robotic hand. There is a new type of electronic hand having motors and sensors in every digit. Hand has two unique features. First, a separate motor is in each finger, which means that each finger is independently driven and can articulate. Second, like the human thumb, the electronic thumb can rotate 90 degrees. This is an example of a robotic prosthesis. Then this is a person using a bionic prosthesis. So just now I'm finishing the process, but I will come to orthosis. But just before I end, I want to just emphasize one thing about advances. Very frequently asked question in the exam. Means alternate year. I have seen many papers also. Alternate year or every year almost one question of advances either in prosthesis or orthosis will be there, because now we expect you to know basic, but when we ask for like recent, there is fourth paper, you may be aware that it focus mainly on recent advances. So in that, very invariably most of the times, sometimes it may not be there, but still advance in prosthesis and orthosis is always there. So usually it is missed or skipped during our teaching. So my request is little focus on that also when you are doing your preparation. And one last thing, sorry, this is 3D printing also is available. But my personal experience, I have seen that 3D printing in upper limb prosthesis has not been so successful, though people are trying. Now coming to orthosis. Again, definition everybody knows. What is it? It is a device which is applied externally to a part of body. Word is derived from ortho, which means straight, and orthosis, either we use orthosis or orthotics, and we use brace and splint. What is the difference between brace and splint? Brace usually correct irregularity, and splint usually we give after surgery and does not allow movement. But these are not exact definitions, just for understanding. There can be some change when, like post this dorsolumbar fixation, we call it brace only, but just to understand. The orthotist is the person who design, fabricate and repair the orthotic device. Now what are the benefits of orthosis? It improves function, save energy and increase endurance. The main aim of orthotic intervention is to function without dysfunction. So what are the indications for recommending orthotic devices? To relieve pain, to limit motion like immolation after surgery, immolation after traumatic injury, compression fracture management, kinesthetic reminder to avoid certain movements, and to correct deformity like scoliosis management, to relieve symptoms of disease by supporting or assisting the musculoskeletal system, to reduce axial loading, to improve function in a certain segment of the body and assist and improve movement and function, reduce muscle tone, protect against injury, provide proprioceptive feedback and provide rest. Now what are the prerequisites of a sound orthotic management? Gait analysis in case of lower limb, evidence of spastic or flaccid paralysis, major joint malalignment contractures, joint stability, joint range of motion, how much is active available, how much is passive, and then mainly in case of upper limb orthosis, what are the patient ideal like grooming, dressing, feeding, hygiene, how he or she is doing. Now design characteristic of an orthotic device: weight of the orthosis, adjustability, functional use, cosmesis, cost, durability and material, and ability to fit various size of patient. Again, in this also ease of donning and doffing, and like some person may have complications like access to tracheostomy site, pactive or other drains, then access to surgical sites for wound care, and aeration to avoid skin maceration from moisture. Duration of orthotic use. It is determined by the individual situation. In situations where instability is not an issue, recommended use of an orthosis until the patient can tolerate discomfort without the brace. When used for stabilization after surgery or acute fractures, allow 6 to 12 weeks to permit ligaments and bones to heal. What are disadvantages and limitations of an orthosis? It limits mobility and RMA of the joint, restrict rotation around the joint, movement is usually limited to a certain direction, and it may cause weakness of other muscles in opposite direction, and device is exposed to wear and tear, and it needs maintenance, cleaning, repairing, and in case of lower limb, if shoes are there, it requires frequent changing of shoes also. What are the points to be remembered for maintenance of orthosis? Patients should be taught for cleaning the leather, oiling the joints, and wash the orthosis if it is possible. All orthosis should not be washed. Like leather orthosis, you should never say that you wash it, and it should be simple and durable as possible. Coming to types of orthosis, temporary orthosis, when we use for certain time after injury or operation, and permanent orthosis, used for whenever there is a muscle weakness, paralysis or deformity which cannot be corrected. The person may have to wear it permanently. Sometimes we use another term also, static orthosis or dynamic orthosis. Static orthosis does not allow movement, and dynamic orthosis allows movement. And coming to the material part, so orthosis can be considered from metal, plastic, leather, synthetic fibers, or any combination. Plastic materials such as thermosetting and thermoplastic are the materials which are most commonly used in the orthotic industry, and in our country also we are mostly using this only. So thermosetting materials can be molded into different shape, permanent shape after heating. They do not return to their original consistency. Whereas low temperature thermoplastics can be fabricated easily and rapidly with hot water, but they are used mainly in low stress activities. And high temperature thermoplastics require high temperature to mold, but they are ideal for high stress activities. So there are different type of materials being used for making an orthosis. Leather such as cattle hide is used for soap construction because it conducts heat and absorbs water well. Rubber has a tough resiliency and shock absorbing qualities. Rubber is used for padding in body jackets and limb orthosis. Metals such as stainless steel and aluminum alloys are adjustable, but they are heavy and not cosmetically pleasing. So metals can be used for joint components such as metal uprights, springs and bearings. Now, selecting the appropriate material characteristic for fabrication of an orthotic device requires consideration of a number of factors. What are those factors? Strength, the maximum external load that can be sustained by a material. Stiffness, the amount of bending and compression that occurs under stress. Example, when greater support is required, a stiffer material is used, and when a more dynamic orthosis is desired, a more flexible material is used. Durability, the ability of material to withstand repeated cycles of loading and uploading. Selection of material for orthotic is based on the ability of material to withstand the day-to-day stress of each individual client. Metal, so density, the greater the volume of thicker material, the more rigid and more durable. Corrosion resistance, it may be affected by chemical degradation. Most materials will exhibit corrosion over time. Metal will rust and plastic become brittle. Contact with human person environment such as dust, temperature and water exert the wearing effect on them. Knowing the client's daily environment can assist in material selection. Ease of fabrication, the equipment needed for fabrication of orthosis. Then coming to the principle of orthotic design. So there are three basic principles, biomechanical principles, which assist in promoting control, correction, stabilization and or dynamic movement. What are these three principles? Pressure principle, equilibrium principle and lever arm principle. So what is a pressure? All of you know, force upon area. So what does it mean? If the greater the area of a pad or plastic cell, the less force will be placed on the skin. So we have to be very careful that orthosis should not cause any shear or stress on the skin. Then equilibrium principle, the force should be equal. The sum of force and bending forces should be equal to 0. Then lever arm principle, the farther the point of force from the joint, the greater movement and the smaller the magnitude of force required to produce a given torque. So that's why we see most of the orthoses are given with long metal bar or plastic cells. These three principles act dependently on each other. So when we design a prosthesis or we order a prosthesis, we are going for checkout, we should see that the adequate padding covering the greatest area possible for comfort. The total forces acting on the involved segment is equal to 0 and there is equal pressure throughout the orthosis and no areas of skin irritation, and the length of orthosis should be suitable to provide an adequate force to create the desired effect and to avoid increased transmission of shear forces. So by this we understand all these three factors are interdependent. So now coming to general orthotic considerations, the force at the interface between the orthotic material and the skin, degree of freedom of each joint, number of joint segments covered in the orthosis, then neuromuscular control of a segment including strength and muscle tone. And the material selected for orthotic fabrication, the activity level of the client. The goal of orthotic fitting is to meet the functional requirement of the client with minimal restriction. Now, functional orthotic considerations are like alignment, whether we are using it in musculoskeletal disorders or neurological disorders. Then movement, a joint may require assistance with motion or resistance to excessive motion like AFO or RGO. Then resistance with joint motion, then like musculoskeletal and neurological disorders like shoe insert for a patient with foot deformity, finger splints for arthritic hand. The neurological disorders, arm sling for neurological disorders, and Swedish knee cage for unstable knee. And weight bearing to reduce axial loading and reduce the forces placed on a joint. Musculoskeletal disorder like shoes insert with metatarsal pad, and neurological disorder like heel wedge for a child with cerebral palsy. Protection, protective segment against further injury or pain. In musculoskeletal disorders, functional knee brace. For neurological disorder like cock-up splint for post-spinal cord injury. Now coming to the upper extremity orthosis. So there are basically, we divide hand orthosis, wrist hand orthosis, elbow orthosis, elbow wrist hand orthosis, shoulder orthosis. So hand orthosis more commonly used opponent's orthosis. It maintain, assist or provide opposition by stabilizing a thumb in a functional position. Then wrist hand orthosis, we commonly call it as a resting hand splint. It is commonly used to prevent contractures, maintains neutral static wrist, hand and finger. Then wrist hand orthosis, usually we call it cock-up splint. It is usually used in cases of carpal tunnel syndrome, maintains wrist in slight extension. Then this what we call is either tenodesis orthosis or lively splint. We use in cervical spinal cord injury that results in paralysis of prehension and creates extension of the second and third digit and thumb with active extension of the wrist. Then there are over the self orthosis around the elbow, lateral epicondylitis brace, or we commonly called it tennis elbow brace. Then elbow sleeve, commonly used for minor soft tissue injuries, compression, sprain and strains. Then elbow orthosis, it can be either molded or over the self, like it can be custom molded. Total contact elbow orthosis can be used for prevention of contracture and in case of fracture for immobilization, may include a wrist or hand component. Elbow joints may be static or dynamic. Then shoulder orthosis, we commonly call it shoulder sling. It is used for shoulder immobilization. And another type of shoulder orthosis is airplane splint, which maintains abduction at the glenohumeral joint. Mostly in our practice, we usually give in brachial plexus injury. In clavicular orthosis, it is also known as clavicle brace or clavicle support, is designed to support an immobilization for clavicle fractures or other clavicle related conditions. It helps stabilize the collarbone, allowing proper healing and preventing excessive movement. Usually in proximal and distal part of the clavicle, surgery is mostly indicated, but in mid part of the clavicle fracture, this can be given. Then there are some advances also. What are those advances? Electrical power prehension unit. It provides dynamic prehension with a locked wrist in the EPPU. It is an extremely powered prehension orthosis that drives energy from a rechargeable battery pack. And DC motor that closes the hand with one polarity and opens with the opposite polarity. And gross motion operates a rocker type electrical switch assembly, and typically pronation will produce prehension and supination will produce hand opening. This is the. Then there is another variety, implantable freehand grasp system. So neurocontrol freehand system was developed in Cleveland Clinic, Ohio, USA. It is an implantable functional electrical stimulation device intended for restoration of hand function in C5 and C6 level tetraplegics, and it consists of an active receiver stimulator which is placed in the chest wall. This is the way it works. There is a receiver here, controlled, and finally the person is using it. And now it is very common in the PMR setup, Armio. Many people may have seen it, or some new advanced center are getting, but this is mainly used for training purpose. It is not like it is given to patient and can be, it is mainly used for a training purpose. What is it? Arm weight support, exoskeleton for movement guidance, augmented performance feedback, and grasp and release exercises, increase in active range of motion, increase in strength and endurance, facilitation of self-initiated movement, and increase in selective control. Mainly there are three or four variations are also available in this: spring system, boom system, powered system. This is just a person using arm. Thank you.